This is Patty Teal, founder of the Hub for Podcasting Network. Stay tuned. Healing with Dr. Gloria Kaye is up next.
So sometimes with remote healing, the results come even more quickly and more profoundly than an in-person healing. And what I think happens is the light waves are sent to the individual, and those waves affect the individual cellularly, and that's why problems resolve. When someone tells me what their issues are, I don't need to see them. I'm able to tune into what the issue is. So I don't actually need to meet the person, but it's very easy for me to tune in. However, at this point in my career and in my life, I'm able to discriminate, and I only tune in when I'm really asked to help. So if someone wants help, I want permission. It's not like I'm healing the world. I'm here healing a very specific complaint. So I've turned this, it's site specific. So if you have a knee issue, that's site specific. If you have a headache, that's site specific. It's not healing the whole body. It's not sending good energy to the world, to the room, to your body. It's site specific. So I can see where the distress is, but it doesn't necessarily mean that's where I'm going to start. So very frequently, if there's distress on the left side, I'll go to the right side. And my explanation for that is there would be an over energy on the right side and a deficit on the left side. So I try to balance that out. And I think that's why I've been so successful with pain management. I can't impress how quickly that once I'm tuning into something and send energy there, that the issues get resolved. And I still believe that the issues get resolved cellularly. There's not always a full resolution instantaneously, but the connection can be made instantaneously. All right, good. So I'm in New Jersey. He's about 120 miles away. We're all over the place. Okay, good enough. So, client, tell me what your issues are.
My name is Andrew. Thank you for inviting me today. I recently started walking again, and remarkably, I'm able to do that without pain. Before coming to you, I would have chronic pain in my foot. I walk about 3 to 4 miles a day. Some of that walking is on a boardwalk. Some of that walking is on the beach on soft sand. I was favoring the sand as so to avoid any pain in my foot. Recently, I've been increasing the miles. You always have it lingering in the back of your head. I wonder if I'm going to start feeling that pain again.
Well, my immediate response to what you're saying is that you have an imbalance in your sacrum area. When you have foot pain or knee pain, I usually go to the back to see what's going on there. So you say it's your right side that you're feeling the pain on, right? So you're probably favoring the right side, putting more weight on your right foot than your left foot. Do you believe that's correct when you're walking?
I mean, it could be. I'm right-handed. I favor everything on my right, so that wouldn't be impossible.
Okay. That being said, I'm going to work on the left side of your sacrum and try to help you gain some balance in your back. So just give me a moment. You probably will begin to feel something, or you may not. I usually can tell when the energy is being received. So again, give me a moment. I'm right on your SI joint on the left side, and I'm in there asking the body to balance. Okay. So yes, and your hips need to be aligned as well. Mm-hmm. So I'm going to go from your SI joint to your hip as well. And I don't know if we'll be able to see the results of what I'm doing, but I can see that there are shifts going on in the sacrum and in your left hip. So let's just sit with that for a moment and let that energy tool around in there. All right. So I'm, for the moment, going to be complete with that area. Now I'm going to your right knee, because what has happened is that there is an imbalance, and that imbalance really extends to your right knee as well. Do you ever have right knee pain or no?
Yeah, I used to. I mean, I'm walking now, but I'm walking because when I when I was running, I would have pain in the knee. So I don't think you're far off.
So would you say there's still a weakness in the right knee?
I haven't been running for at least 6 months, and we've had inclement weather, but I would tell you that if I start running again, I had planned to do it very slowly, so I wouldn't have pain in the knee.
Okay. Well, in my opinion, from what I'm seeing, it's just coming from an imbalance. I don't think you have a knee injury. You don't have a hip problem per se. It's just a question of imbalance. You can check this out. I should have had you do this before. But if you place your hands on your hip bones, you can tell which hip bone is slightly forward. They're probably pretty balanced now. But if any of the listeners want to check out the hips and to figure out how to do that, the easiest thing to do, and I'm not asking you to do this, you can just place your hands on your hip bones. But if the listeners would like to check out the hip bones, just lie flat on your back, place your left hand on your left hip bone, your right hand on your right hip bone, and just see if there's a difference. And regardless of where the pain is, you're going to want to focus on the high side, nearly always the high side that you focus on. Well, I think we've corrected that pretty much. Let me go down to your feet. Yeah, I think we got it.
Great.
So let me just run a little energy through your body. You can close your eyes for a moment. I'm going to start at the solar plexus. So I'm using the chakra model and the heart chakra or the thymus, the thyroid, pituitary, there you go. Oh, this is nice. So we started at the solar plexus. Let me just run that one more time.
I do feel an energy happening. I don't know if it's manifesting because of what you're doing, but it feels, almost like I'm sitting in the sun.
Oh, nice.
Mm-hmm.
All right. One more little thing. I'm going to go back to the SI joint and make sure that looks good. So now I'm doing the SI joint on the right side and the left side, just to make sure that's balanced out. Now, before we leave each other, I want to do the backs of your knees. That is an area that is so overlooked, but really quite critical.
The backs of my knees. Okay.
The backs of your knees, right. You keep your eyes closed. I'm just running energy. And now down to your feet. All right. Well, hopefully we've corrected your issue.
It is interesting to be speaking with you and then feeling a different kind of energy flowing through me as we're speaking. It's kind of neat. Okay.
Is there any other comment you'd want to make?
No. I mean, that was relatively quick. And
yeah, it's very quick. It's very quick.
I'll tell you that we have a geriatric dog, and he's having a lot of problems with his hindquarters. This has kind of come on in the last few months, and before this he had some seizures. So I don't know if it's related to that or if he's just getting old. But he is in pain. Last night I had to sit with him because every time I gave him a little baby aspirin and I gave him a little hemp oil, which I was told is really good for dogs, and it seemed to help. And I was kind of seeking your advice. If you can fix my foot, I'm sure you can fix my.
So let me ask you this: how severe were the seizures, and how frequently did they occur?
Yeah, so I would describe them as mild, because he would it wouldn't go on for a long period of time, but it was obvious he was having them. One time he was standing in place and literally shaking, and then another time it happened when he was in his bed, and he was kind of convulsing.
Did he have any medication?
Did he have it, or did I give it to him after this happened?
After this happened.
Yeah, so after it happened, the vet prescribed what's an inflammatory to relieve some of the pain. that
Wait a minute. I'm sorry.
Seizures, nothing. There wasn't anything in particular with the seizures. They at the time they examined him, there were no signs that he had the seizures. But I had mentioned that I was concerned because he had become much more inactive, and they thought that there could be some other things going on.
Okay, so we don't know if there's a relationship. Okay, I'm ready to.
And to tell you the truth, the vet didn't know.
Okay.
Just that it was he. That's the funny, not funny, but that's the strange thing about a dog that has a seizure like that. And unless they're having it right at that moment, they can't really comment on it. But
we need to start working on the dog.
Sure, absolutely. I'm not sure how we're going to do that because I'm on webcam. But
do you want me to use my psychic eye to work on your dog?
Yeah, whatever you want to do. I mean, I can maybe use my phone to.
No, it's fine. It's fine.
Okay.
You mean to see changes?
Yes, that's what I was thinking. He's in my house, but I'm in my office, and I'd have to, go to another floor to get to him. So, whatever you want to do.
Well, I don't think we're going to see very much, but I'll tell you what I will be doing.
Sure.
So I didn't have. So the information about the seizures is interesting. Yes, it can be connected to what's going on now, and also, you happen to know the name of the medication that he was taking for the inflammation?
Not offhand, no.
So he was treated for inflammation, not for seizures, pharmaceutically.
Well, pharmaceutically, yes. They said that to keep an eye on him, and if he had the seizures again, to take them back, and he hasn't had them since. So
okay. So what I'm going to do, I'm going to go to the area. I'm going to go to his head, and I'm going to be on the area that connects his head to his body. So kind of like the back of his neck. So that's where I'm going to start. What is your dog's name?
Buddy.
Okay. So I'm in there now. So this is good. So, if it is a neurological thing, then what I'm doing now perhaps will help. Still in there. This is quite interesting. Now I'm going into his mouth. This is really quite interesting.
Can you do something about his dog breath, or?
No, sorry. No, I don't do dog breath. Or human breath, sorry. But let me get in there. Yeah, this is quite interesting. So if there is a neurological thing, what I'm doing now should or will hopefully affect him positively.
Okay.
And are you saying there's hip dysplasia or just difficulty getting around?
Oh, there's definitely something going on with his hip. This morning, he tried to get up on his own, and he just fell flat like a pancake. And
so when he tries to do this, I hope he's not doing it on a slippery surface, because it will be easier if he's on carpet.
Right. Unfortunately, we don't have a lot of carpet where he likes to hang out. But I was actually going to get some traction booties for him, if you're familiar with those, to give him a little traction when he's walking on the hardwood.
Well, once he's up, is he okay?
Yeah. I mean, this morning he could not get up without assistance. But as the day progressed, he was fine. He was walking around. So.
All right, let me just do a little bit on the hips. But that neurological stuff was really quite interesting, because I definitely was in there. And hopefully you'll see a more lively dog, happier dog. So I'm working on the hind end now. Whoa, okay, I'm really in there. So this is what happens to me when I'm really in there. It's almost as if there's a laser beam going right to his hindquarters, both of them. So it's like a laser beam, and then the energy radiates from where I'm actually focusing. Well, I'm kind of impressed.
Good.
So,
well, I don't hear any yelping below, so
that's a good sign. All right, I think we're complete. I want to thank you.
Oh, you're very welcome. Thank you.
And don't hesitate to contact me if you need more information or you're interested in a session. I'm happy to explore the possibilities with you and to let you know what I'm seeing. Well, I'm going to give you my telephone number. However, I have a very extensive website, and you can contact me through that. But my telephone number is 805-701-0363. I'm going to repeat that. 805-701-0363. And that's all on my website as well. My website is my name, Dr. Gloria, Kaye, and the doctor is Dr. No periods.
Would you like to give Dr. Kaye's miraculous healing ability a try? What have you got to lose? Free for those who schedule a healing session for airing on this show. Visit her website at drgloriakaye.com or email her directly at drgloriakaye@aol.com. That's drgloriA.com.